just want to make a quick video explaining how you can quickly memorize the functions of the epithalamus, thalamus, and hypothalamus. The entire video is probably going to be around 15 to 20 minutes, but that's just because I need to explain all the details. When you do the diagram on your own, it should take less than 5 minutes to memorize basically this entire page of first aid. So to start, let's just draw the brain so we can visualize where we're at. If this is our cerebrum, and then that's our cerebellum, that's our brainstem, and let's say this is our corpus callosum, and here would be our pituitaries. Then the thalamic regions are going to be more or less over here. When you see it on a cadaver slice, it'll kind of look like this. So this right here would be the thalamus. The hypothalamus is going to connect basically to the pituitary. Obviously you're going to have your infundibulum right over here. And the epithalamus is not something that we discuss in class, nor is it in first aid. But if you're doing the On King flashcards, you might come across it. And that would look something like this. It's kind of hard to visualize, but it's also a very small organ, and it's, well, not organ structure, and it's not super important, but it's good to know what we're looking at. Let's quickly talk about the epithalamus. So the epithalamus, as we previously depicted, is this very small and not super important organ. I'm going to go over it in a little bit detail. You definitely don't need to know this for a STEP or even the BMB exams, but in my personal experience, having a deeper level of understanding of the material helps you memorize it better and gives you context for other things that happen in the body. So there's two things that are important with the epithalamus, and if you've been doing OnKing, you're probably familiar with this. The epithalamus contains two things. One, it has the pineal gland, and the second thing it has is called the habenular gland. Okay, so let's start with the habenular gland. This one, it's not important at all for you guys to remember it, but basically it's involved in a little bit of everything. It's involved in nociception, mood disorders, it's involved in sleep-wake cycles, and it just basically connects to the pineal gland, but other than that, you definitely don't need to know it any deeper. So let's go a little bit more in depth on the pineal gland. As I'm sure you guys are aware, it's involved in the sleep-wake cycles. Generally, I would say that's pretty much all you need to know, and you probably should know that this is a function of melatonin. But I'm going to go a little bit in depth here. What I'm talking about now is the relationship of the epithalamus, or specifically the pineal gland, to the thalamic or hypothalamic nucleus called the SCN. So I'm going to relate two concepts that are going to come up in this video. So I just said there's a relationship between the SCN and the epithalamus, specifically pineal. And basically the way it works is you will get light sensation from the environment, and then your eyes will perceive that. And in the back of your eye, you have a retina. Okay, in this retina, you have your ganglion cells. When you have light, these melanoopsin containing retinal ganglion cells will send exciting cells signals to the SCN. In darkness, however, or rather the absence of light, this activity of the signaling from the ganglion cells to the SCN is reduced. Okay, so when we don't have this light sensation, the signaling to the SCN is downregulated. This causes the disinhibition of the retino-hypothalamic tract. You definitely, again, do not need to know this level of detail, but sometimes it's good to know. Okay, so if you have the disinhibition, that means that's an activation. And if you have the disinhibition of the retinohypothalamic tract, this allows a superior cervical ganglion. So let's just write that in there. Superior cervical ganglion. This allows a superior cervical ganglion to release norepinephrine. If you're going to take away anything at all from this video, you definitely need to know that norepinephrine is released by the superior cervical ganglion in the absence of light. Okay, this release of norepinephrine is actually going to then move to the pineal gland. So this now moves to the pineal gland. Okay, and within the pineal gland, you have certain cells called pinealocytes. And the release of norepinephrine onto the pineal gland will allow the conversion of serotonin to melatonin. And as you know, melatonin is the goal of this pathway, and that is what's going to promote the sleep-wake cycles. So before you go to bed, make sure that you are turning off those cell phones. Talk about one of the big things for this section, the thalamus. Okay, I'm not going to draw this perfectly accurate to anatomy. I'm going to draw it in such a way that it's going to be very helpful for you to remember. So let's just say the thalamus is this kind of organ. And just to orient ourselves, this would be anterior. And this is posterior. And I drew the arrows going the same way, just so you can imagine that, you have some guy, there's his nose, and he's looking that way. Okay, so back to the thalamus. The first thing I always like to do when I'm imagining structures is start from the midline. Okay, so what we have in this midline does that. And that is going to be called your internal medullary lamina. Don't need to know it, but it's helpful to just orient yourself. Okay, so there are 6 things that you have to memorize regarding the thalamus, and we're going to break it down into objective parts. Okay, just for simplicity's sake, I am going to draw a rectangle going like this. I know it's not 4 sides, nor does it have 90-degree angles. It's a rectangle. Don't fight me on this. Okay, so if I told you this is anterior and this is posterior, the first thing that we're going to do is divide this in half. Okay, so if I divided that in half, would you not agree that this is our anterior group? And then this is our posterior group? Yes? Yes. Okay. So when we're making out the table of all our nuclei, we're going to start by saying we have a whole ventral group, which, by the way, is all this entire rectangle. Let's write over here. Okay, and then we have a posterior group, and we have an anterior group. Okay, then we're going to divide this in half one more time. Okay, now that we did that, we will call the back sides of our divisions L's. So this is going to refer to lateral. Then we're going to call this one M, and this one is A. This one for medial, and this one for anterior. Okay, so then we fill out the table. We're going to get a ventral, posterior, lateral nuclei. That's going to be your VPL. You're going to get a ventral anterior group. Or sorry, if we're staying on the posterior group still, we're going to get a ventral posterior lateral group, ventral posterior medial group. So that's going to be our VPM. And if we're talking about our anterior group, well, that one just stays the way it is. So this is our ventral anterior group. And then here you have L, so ventral anterior lateral nuclei. Okay, and then in the back, you're going to have two circles. I know we put L in the back of our groups, but unfortunately, L is going to come in the middle. So then M comes in the back. And these are geniculate nuclei. So if we're extending down the table, we're going to get our M circle and L circle. So this is going to be our medial geniculate nucleus, and this is going to be our lateral geniculate nucleus. Okay, I promise you guys that learning this diagram will help you remember the functions, and I'm going to do exactly that. So I'm going to start by going further down on my page, and I'm just going to write in the nuclei. I'm going to write in VPL, VPM, V anterior, V lateral, lateral geniculate nucleus, and medial geniculate nucleus. Okay, the things that you have to absolutely know are the inputs, the senses, the destination. In first aid, it'll tell you the mnemonic. You don't have to remember it, but sometimes it can be helpful. So I'm going to write input here. I'm going to put the senses here. And destination. Okay, so this diagram can actually help you remember pretty much everything that you need to know. Quick aside, point something out here. So this would be the image of like all your hindbrain structures or brainstem structures. As you can see, here would be the anterior wall of the fourth ventricle, and then down here you would get your foramen of Magendie and then foramen of Luschka. But specifically, we're looking at the lateral geniculate nucleus and medial geniculate nucleus. As you can see, the two bodies are right here, and you get your superior and inferior colliculi up here. But as you can see, the medial is going to be more medial to the midline of the brain, and lateral is lateral. So if you were to do it on a sagittal section, you would see lateral down here, medial down here. Again, not perfectly anatomically accurate, but good enough. I'm going to make a slight revision here, and I'm going to swap around the M and the L. And this will make a little bit more sense in just a second. So let's just write in L here and M. All right. Okay, so like I said, this diagram is going to help you remember the input, senses, destination. So first, let's do ourselves a favor and just draw lines upward. So if this is our anterior region, we're going to draw a line up, posterior, line up, medial, line up, and lateral, geniculate, line up. Okay, so what is the functionality of drawing these lines? So the anterior group of the ventral nuclei of the thalamus, so that's going to be your ventral anterior nucleus and ventral lateral nuclei. The destination of these is going to be the motor cortices. So if you were to look at the brain, like in this orientation, your frontal lobe is actually up here. And what's in the frontal lobe? Well, I'm glad you asked. That would be your motor cortices. Okay, great. So now let's move on to the posterior group. So if you're talking about the posterior thalamic nuclei, that would be your ventral posterior lateral nucleus and ventral posterior medial nucleus. And these guys go to the somatosensory cortex. So as we do the line up here, we can see if this is about the level of the central gyrus, you could say that your somatosensory cortex is right here. Somatosense. I'm not going to write out the whole thing, but you know what I mean. Okay, so this was our medial geniculate nucleus. If you draw the line up here, actually more specifically around this region, you would get Broca's and Wernicke's region, which is helpful because the medial geniculate nucleus, its destination is the auditory cortex. So I'm just going to write that in here. The auditory cortex. The lateral geniculate nucleus. If we draw the line up here, and we're looking at this part of the brain, this is actually where our occipital lobe is. Well, great. That's actually the answer for what the destination of lateral geniculate nucleus is, which is going to be your visual cortex. Visual cortex. And remember, I did not write out these completely, right? So the anterior group goes to your motor cortex. Posterior group goes to your somatosensory cortex. The medial geniculate nucleus goes to your auditory cortex. And the lateral geniculate nucleus goes to your visual cortex. All right, let's fill that in on our table. So as we said, VPL, this is going to be your primary somatosensory cortex. Great. VPM, again, these are both posterior groups. So posterior means we draw the line up. We have our primary somatosensory cortex again. Now we're at the ventral anterior and ventral lateral nuclei. These are together part of the anterior group. So the VA and the VL, both of these are going to go to your motor cortex. I'm just going to write it larger so that it shows between the two. Motor cortex. Ignore the spelling. And then you have your lateral geniculate and medial geniculate. Remember the medial? We just drew it straight up. And where did that go? Right, our auditory cortex. And then our lateral geniculate nucleus was in the way back of our brain, and we do the line up, going to our occipital lobe. So then your lateral geniculate nucleus should go to your visual cortex. Okay, great. That is the destination of all the nuclei. So let's talk about the senses and the input. And again, it makes more sense if you go from destination backwards into input. So we're talking about the senses for the VPL. So this is going to be vibration, pain, pressure, proprioception, light touch, and temperature. How do you know that? Well, if all of these two nuclei are going to your primary somatosensory cortex, well, what are the inputs? Well, that would be your spinothalamic tract and also your DCML, or dorsal columnar medial lemniscus. So if those two tracts are going to go through both of these nuclei, through the VPL nuclei, then your sense would be vibration, pain, pressure, proprioception, light touch, and temperature, right? Because if they're going to the somatosensory cortex, you're going to get your senses. The only thing different that the VPM does from the VPL is that your VPM is going to give more to your face sensation and taste. So I'm going to write face here, face sense, and taste. Okay, you might be asking, well, if the VPL and the VPM both go to the somatosensory cortex and all of these are senses, how do I know the difference between face sense slash taste and the rest of them? Well, if we look at where the medial nucleus of the posterior ventral group is, this is kind of in the midline, right? And if it's like in the middle, that's where your cranial nerve 7 and 8 are gonna come out, right? So if 7 and 8 come out, 7 is involved in face and taste, right? Because the chorda tympani branch of the facial nerve is going to give you taste sensation. And when you get cranial nerve 7 damages, you're going to lose sensation to that upper face. Okay, now let's finish off our ventral anterior and ventral lateral. Remember how I drew the motor cortex kind of big? Yeah, that's because VA and VL go together. So VA and VL, these are going to go to our motor cortex. So what do? Motor functions. Wow, that was incredibly difficult, wasn't it? It's not. Okay, so now we have LGN and MGN. Okay, well, the LGN goes to our visual cortex, right? Because we just drew the arrow up. Well, so what is that going to do? Visual or vision, however you want to put it. Okay, then that leaves the MGN. If this is going to auditory cortex, that's going to be for hearing. All right, now let's do the inputs. So I told you the VPL, which goes to the primary somatosensory cortex, and it's lateral, so it's going to take all the things aside. So it's going to take your vibration, pain, proprioception, pressure, light, touch, temperature. Well, guess what? That sounds like spinothalamic, and that also sounds like DCML, because vibration, proprioception versus pain and temperature. Yeah, so that's actually the input. The input would be DCML and spinothalamic tracts. Okay, then VPM. I told you the VPM, it goes to the somatosensory cortex, but it's in the middle, so it's going to give us face senses and taste. Well, what does that? Trigeminal and the gustatory pathway. All right, so now we're on to our VA and VL, which we wrote all this text in big text, so these two go together. All right, so the VA and the VL, if they're doing motor functions, that probably is going to be your cerebellum and basal ganglia, because those are the two main important groups of structures that are involved in motor coordination, right? So let's just put it like that. Basal ganglia and the cerebellum. Okay, so LGN and MGN. If you watched yesterday's lectures, this should be really easy for you. If you didn't, it might be a little difficult. Unfortunately, you just got to memorize this. So I'll just tell you, the hearing, which is involved with the auditory cortex, well, you're going to need something to do that, and that would be the nuclei. Well, what nuclei? The inputs are the superior olivary, and also the inferior colliculus of the tectum. Inferior colliculi. Okay, then that just leaves the LGN. Well, if the LGN is doing vision, well, you would think that it's just cranial nerve 2. And, you know, you're kind of right, but if you're thinking about the cranial nerves, right, they have this chiasm and they cross. The cranial nerve is just this part. This is the chiasm, and these are the tracts. And the tracts are what signal the information down to the rest of our brain, correct? If you stop at just the nerves, you're not sending any information to the brain. So the LGN, the input is CN2, the optic chiasm, and also the optic tract. Okay, so just by drawing this, you actually should be able to know everything in this table without any trouble. And again, I told you I was going to take this slow the first time we do it, but if you're doing it on your own, this should not take more than 2 minutes to actually memorize everything. The thalamus. Let's start doing the hypothalamus. So let me just write that out here. Hypothalamus. All right. So the hypothalamus is going to be quite the complicated subject, but we are going to make this very simple for us. So first, I'm going to start by only doing the drawing. Then I'll go over the functions afterwards. Okay, so if we're thinking about the hypothalamus, right, we are going to draw our region. Don't forget to draw the balls and the rest of it. Yeah, because that's kind of more or less where this hypothalamic region is. Okay, so that's the first step, right? The first step is we're going to draw the balls. Okay, what is our second step? The second step is we need to identify the location of the suprachiasmatic, or rather, the optic chiasm. So I'm going to draw this kind of transversely, and it's not 100% anatomically correct. It's more or less in this region, but for the sake of this drawing, just assume I'm right. Okay, so if this is the optic chiasm, then the nucleus that you get right on top is called the SCN, or rather the suprachiasmatic nucleus. Okay, and if we're talking about the nuclei in the area adjacent to the suprachiasmatic nucleus, rather than the whole optic region, you can actually consider all of this as optic nuclei. So I'm going to draw two of them right here. Okay, if this is the optic and this is on top, we're actually going to call this the pre-optic nuclei. And if this is pre-optic, before all the optic nuclei, and this is SCN or suprachiasmatic, then between them is after the pre-optic but before the SCN, so that's going to be our supraoptic. Okay, so pre-optic plus supraoptic. Okay, and I know you're thinking, well, hey Jay, they're not going to ask me what the location of the nuclei are. I need to know the functions. Just stay with me. It will make a lot of sense. Okay, the next thing that you need to do is identify the location of the ventricle. And I'm going to tell you what the ventricle is in a second, but I'm actually going to ask you to figure it out, or rather just guess. If this is the boundary of the ventricle, and we're kind of closer to the bottom part of the brain, near the hypophyse and the pituitary, what ventricle do you think this might be? Alright, I'm assuming you pause there. The answer to that is the third ventricle. So I'm going to put in parentheses here, 3. Okay, so if this is our third ventricle, then a nucleus that comes right here must have something to do with the ventricle, yeah? Well, you would be spot on. This is the paraventricular nucleus. So I'm going to write here 4B. I'm going to call this our paraventricular nucleus. Okay, so if this are 4 nuclei up here, then we can start moving on to the nuclei that are under the boundary of the third ventricle. Anatomically, I wouldn't say that they're actually underneath the third ventricle. I'm just saying for our drawing, it'll make a lot more sense. Okay, so we can start down here. This nucleus down here is called the arcuate. And I know I said I was going to talk about just the anatomy and then go on to the functions, but I want to explain to you a little bit about how this makes sense. If I told you these are your visual nuclei, and I say visual quote unquote, these nuclei down here are going to be called your cafeteria nuclei. Let's write that in. Cafeteria. So you can actually thank our classmate Cameron for giving you this mnemonic. And the reason I call it the cafeteria, or rather the reason we call it the cafeteria nuclei, is because all the nuclei down here are somehow involved in metabolism. So the arcuate nucleus, which I will touch on later, is involved in metabolism. It's got a section inside of it called the POMC, and you probably might recognize the POMC as it relates to insulin in diabetic patients. So the arcuate nucleus is going to be involved in functions about the catabolism and metabolism of the things that you eat. All right. So if this is the metabolism, well, you can't do metabolism without actually eating, right? So that's going to be two major nuclei. So this long one that I drew is going to be called your lateral. Okay, and let me go back to the order here. So after we did the paraventricular, we did the arcuate, and we're moving on to the lateral. So unfortunately, I do not have a coronal section for you, or rather I'm not going to draw the coronal section because that's too much work, but you could imagine this lateral is kind of coming out towards you, like towards the viewer, and it's going to, like, I mean, I'm not going to draw it all out, but if this is the coronal view, right, the lateral nuclei is going to do something like this, and then the other nuclei are over here. Again, not anatomically accurate, but this is just to help you remember. So if this is a lateral nuclei, this is going to be your ventral medial nucleus. So let's write that in. Lateral plus the ventromedial nucleus. Okay, so if I told you arcuate is involved in digestion, well, how do you know how to eat? Well, that's going to be your lateral and ventromedial. So the lateral nucleus, this is going to be where the leptin is going to inhibit, because L and L go together. And so if leptin, which is the hormone that tells you to stop eating, inhibits the lateral nuclei, well, then the lateral nuclei is going to be your hunger center. Conversely, the ventromedial section is inhibited by ghrelin, which tells you to eat, so that means it's stimulated by leptin, which means the ventromedial nucleus is a satiety center. All right, so that's most of them. Now there's two left. I'm going to be honest, I have no other way to remember this, so this is just what I do. Draw a little infinity sign on here, because why not? Then we are going to have our anterior nucleus and posterior nucleus. Again, this is definitely anatomically correct, but there is a reason why I put it in this exact location, and I will get to that when I talk about the actual functions of the hypothalamic nuclei. So it's just down here, right, 7, which is our anterior and posterior nuclei. Okay, into the actual functions of these ventricles, let me just do something really quick. We're going to group the nuclei. So as I told you, these are kind of optically related, right? So this is going to be our optic, right? And I put that in quotes. All of these are going to be your cafeteria nuclei. So from the lateral, oops, I should probably just draw this actually. So then from the lateral all the way to the arcuate and ventromedial, that's going to be your cafeteria. I'm not going to write the whole thing out. Cafeteria. Okay, and our last group that I just represented as an infinity, anterior and posterior nuclei. Okay, I'm going to tell you right now, this drawing, again, is not an anatomically accurate, but is very, very helpful for remembering the functions. Okay, so if our SCN, or suprachiasmatic nucleus, is right above the optic chiasm, and the optic chiasm takes in like the nerves, the optic nerves, because optic nerves are up here and the tract's going to be back here, then where do you think this information is coming from? Oh yeah, that's light. Light information is coming in, right? And if you use this to sense light, well, would you say that the SCN is a sun sensing nucleus? Yes, that is exactly what it does. So the sun sensing nucleus, or SCN, this is involved in, and let me change the color real quick. This is involved in our circadian rhythm. Okay, so now we're moving on back to the preoptic, preoptic and the supraoptic and paraventricular nuclei. All right, so I'm just gonna draw something right here. This is a group, and this is a group. And I do this intentionally. So let's just draw a line straight down from our two groups. Does this not correlate to the pituitaries? Yes, yes it does. So this is our posterior pituitary, and that's grouped with our supraoptic and paraventricular nuclei. Well, the function of the posterior pituitary is to synthesize ADH, or vasopressin, as well as oxytocin. And the order here does matter because there's two of the nuclei in this group, right? And if we have the supraoptic right here, supraoptic is going to be involved in synthesizing ADH and vasopressin. Let's write that in. Supraoptic. That's not the color. Here we go. So supraoptic is going to be involved in ADH or slash vasopressin. And then the paraventricular, which is up here, is the second nucleus in the group, so it does a second function. The paraventricular nuclei is important for the synthesis of oxytocin. Great, and that just leaves us in this section the preoptic nuclei, which is correlated to the anterior pituitary. So that means this guy's function is involved in thermoregulation, sexual behavior, and hormone GnRH, because in the anterior pituitary you would get like heat sensing and sexual function. Okay, so this group, which has the preoptic, goes straight to the posterior pituitary. The posterior pituitary. And this group with the supraoptic and the paraventricular goes to the, this is the posterior pituitary. This is your anterior pituitary. Okay, so then let's just fill the table in. The preoptic nucleus, that's going to be involved in thermoregulation and sexual behavior. Okay, that's this group right here. Let's move on to our lateral nucleus, ventromedial nucleus, and arcuate. Okay, so up here, lateral and ventromedial. So these two are also paired. Let's use purple. Why not? So these two nuclei together are the hunger and satiety centers. Obviously, they do different functions. So the lateral nucleus, which has an L in the name, L for leptin. So leptin will inhibit the lateral nucleus. So that means the lateral nucleus is the hunger center. Okay, and if these two are paired, that means VM is the opposite of lateral. So that means the ventromedial nucleus is going to be involved in satiety center. So leptin will activate. Yeah, it's going to activate the ventromedial nucleus, and it's going to inhibit the lateral nucleus. So what does that mean for us? That means that the ventromedial nucleus is going to be our satiety center. Okay, and what did we call all of these nuclei just past the third ventricle? Well, we call that our cafeteria region. So if you're either eating or not eating, whatever it is, you gotta digest it somehow. That's going to be your arcuate nucleus. So the arcuate nucleus, and this is not included in first aid, this is going to be your metabolism center. So just to show you, this right down here would be your arcuate nucleus, and that's your POMC. And the POMC is one of the nuclei of the arcuate nuclei that's involved in metabolism, and it's specifically important for patients with diabetes. All right, getting back to the last bit, we have up here our infinity sign. So what do? Well, you could just go by first aid, and you could say, well, AP is AC, for anterior nucleus is AC. So that's going to be our cooling center. And posterior nucleus is our hot pot center. Hot pot, or rather it's our heating. Later on we'll probably learn about the hypothalamic set point and how that relates to fever versus heat stroke. But for now, just memorize it as the infinity sign. So A for AC, so cooling. And the posterior nucleus, if the cooling is on top, then heating is on the bottom. Alright, so all of that together is the epithalamus, thalamus, and hypothalamic nuclei, including their functions. I promised you that I would make this simple, so now let's do this fastly. I'm not going to go over explaining what's what or how the mnemonic works, because that's what the rest of the prior 40 minutes of this video is. But if you do it and you understand it, it should take you less than 5 minutes to know all the functions of all the nuclei. So let's do it starting now. Okay, so we have our epithalamus, we have our thalamus, and we have our hypothalamus. Let's start by drawing first the epithalamus. Epithalamus looks like this, and it kind of looks like a sideways P, so you know that's going to be their pineal and our habeneural gland. Okay, pineal gland involved in sleep-wake cycles, and it is coordinated with the SCN. Habeneural, you don't really need to know it because it's involved in a bunch of different systems. All right, let's do thalamus. Thalamus, we first draw this, then we draw our internal medullary lamina, rectangle, 2 circles. Okay, so we're going to split this into 4 rectangles now because we have our anterior group and our posterior group. So lateral goes to the sides, medial's in the middle, and A goes here. Boom, all the nuclei. So then our ventral anterior nuclei and the ventral lateral nuclei. These two are paired. These both go, and if you draw the arrow straight up, these both go right into the motor cortex. So the destination of the ventral anterior and ventral lateral nuclei is a motor cortex. That means their sense involvement is motor. That means their input has to be the basal ganglia and the cerebellum. Okay, the back group here is our posterior group. So then we have the ventral posterior lateral nucleus and the ventral posterior medial nuclei. If we draw the arrow straight up, we get our somatosensory cortex. Okay, so that means the destination of both the VPL and VPM is the primary somatosensory cortex. The VPM, which is in the middle, is going to be our face because, facial nerve is kind of in the middle. So VPM, destination primary somatosensory cortex, sense, face sense, and taste. So then our input has to be trigeminal and gustatory pathway. Then the last one here, VPL. VPL, I mean, if this is going to the somatosensory cortex and it's not involved with the face and gustation, that means it has to be vibration, pain, pressure, proprioception, light touch, and temperature as our senses. Well, all of these come from two major tracts. So what are the tracts? Spinothalamic and DCML going into the VPL and VPM. Okay, the back two, lateral geniculate nucleus, medial geniculate nucleus. If we draw our arrow up, we get to the auditory center with the Broca's area and the Wernicke's area. So that means our destination of the MGN, or medial geniculate nucleus, needs to be the primary auditory cortex. That means it's involved in hearing. That means the inputs have to be the superior olivary and inferior colliculus of the tectum. The last thing that we have to worry about is our lateral geniculate nucleus. If we're drawing the arrow up, this is where the occipital lobe is. So that means lateral geniculate nucleus needs to go to the primary visual cortex, which means the sense is vision, which means the input has to be cranial nerve 2, the chiasm, and the optic tract, because the chiasm and the optic tract are the back parts of our whole optic nerve system where we get the inputs. Boom, that is the thalamus completed. Now let's do our hypothalamus. First things first, we are drawing the balls. Boom. Okay, we did our optic chiasm. That means this right here is the suprachiasmatic nucleus. Suprachiasmatic nucleus, it's above this eye region, and it's a sun-sensing region, which means the SCN, which is also involved in our pineal gland. That means it's involved in our circadian cycles, or rather sleep-wake cycles. Okay, adjacent to it, we have the preoptic, and we have the supraoptic. Okay, these two are kind of related in this area. And then we have our third ventricle. So that means this is our paraventricular nucleus. And I told you these guys are related, and this guy's related, and these guys are all grouped. So preoptic nucleus, if we're going straight down, anterior pituitary. That means preoptic is involved in thermoregulation, sexual behavior, and also the release of gonadotropin releasing hormone. So if the supraoptic and the paraventricular nuclei are together and they extend down, going into the posterior pituitary, so our supraoptic and our paraventricular nuclei together synthesize ADH and oxytocin in that order. Okay, now that we've finished this section, we're behind the third ventricle. That means we are in our cafeteria region. So we have our lateral nucleus here. We have our ventromedial nucleus here. Then we have arcuate all the way down here. So lateral nucleus, L and L, leptin, inhibited by leptin. Ventromedial, activated by leptin. So the lateral nucleus is going to be our hunger center. Our ventromedial is going to be our satiety center. Boom. And this is our cafeteria region, these two nuclei told us to eat. So arcuate has to be our metabolism nuclei. So it's the one that also has POMC related to type 1 diabetes. And then up here, boom, draw our infinity sign, A, then P, following alphabetical order. So our anterior nucleus is going to be involved in cooling, and our posterior nucleus is going to be involved in heating. Boom, easy. Under 5 minutes, you know the function and location of every single nuclei in the thalamic region.